Every so often we take our children to the doctor for a checkup. This can be, as an infant, multiple times a year, and then once you get older it's only a year. Your child's healthy, but then the nurse comes in and is like, it's time for some vaccines. As a parent, we're often wondering, how can our child's immune system handle all of this? They're so small, and they're obviously not developed fully yet. Perhaps a better question is, how can we expect the child's immune system to fight off a potentially deadly disease like the measles? According to the National Center for Immunization and Respiratory Diseases, when babies or really anyone gets sick, their body fights off the antigens, and then they get an immunity to this illness. Vaccines provide a way for individuals to get the immunity without having to be sick. Today I hope to show you that vaccination is the best way to protect your child as well as the community. First I will address the myths behind vaccines, then I will describe how different types of immunity protect your child as well as others. One of the biggest resistance to vaccines started when Andrew Wakefield published a paper saying that MMR vaccines cause autism. According to Steve Novella, a medical doctor in the UK, said Wakefield's findings could not be replicated in any labs, and after a decade of research, the MMR vaccine was cleared of all links to autism. The General Medical Council of the UK said Wakefield's papers violated ethics codes, and his license to practice was revoked. There are many reasons why Wakefield's paper was discredited. According to Novella, Wakefield was hired as an expert in MMR vaccine injury suits. Also, some of the children in his study were children of the parents who Wakefield was helping. Despite Wakefield's paper being discredited, there are still people who believe his findings were valid, even though the National Medical Council has said it's not the case. Some simply believe that because of certain vaccines, certain diseases no longer prevalent, that we don't need to vaccinate against anymore. Although this seems like a pretty good idea, it's like, people aren't getting sick, why do we need to vaccinate it? Well, this isn't the case, and the results can be devastating. According to the National Center for Immunization and Respiratory Diseases, in 1974, Japan had nearly 80% of its children vaccinated against pertussis, and decided since there were no longer deaths to pertussis and only very few cases reported, that they didn't need to immunize against it. Well, only 5 years later, in 1979, Japan was experiencing a pertussis outbreak with over 13,000 cases and 41 deaths. A more recent outbreak occurred in the U.S. in 2015. According to the National Center for Immunization and Respiratory Diseases and the Division of Viral Diseases, a large outbreak stemmed from a California amusement park, Disneyland. A little bit further back, in 2014, there were 23 measles outbreaks, which all stemmed from unvaccinated Amish communities in Ohio. So as history has already shown, we have to vaccinate to prevent large-scale outbreaks. Vaccinating may seem like it only protects the person that's getting the vaccine, but this isn't the case. According to the U.S. Department of Health and Human Services, since 2010, there are between 10,000 and 50,000 pertussis cases each year in the U.S., and 10 to 20 babies who are not old enough to receive the vaccine died each year. The idea that vaccines help others as well as the person who is vaccinated is called herd immunity. According to Health Triage, herd immunity protects those who cannot receive the vaccine or those who already have a weakened immune system. This can be infants, the elderly, and anyone who is already immunocompromised. This is a picture explaining herd immunity from the College of Physicians in Philadelphia. The graphic shows the spread of disease and the effectiveness of herd immunity. The blue people represent those who are healthy and unvaccinated, and the yellow people are vaccinated and healthy. And the red people, as you can see, are infectious and contagious. And as the graphic shows, the more people that are vaccinated, the less likely that a vaccination not cause As you can see in the graphic, the more people that are immunized, the less likely an outbreak will occur. Therefore, we can have many people vaccinated against the disease. Outbreaks such as at the bottom will not occur. As you can see, there are only a few people who were not vaccinated, and the outbreak was minimized. According to the U.S. Department of Health and Human Services, through herd immunity, we can also eradicate diseases such as smallpox. This happened because everyone was vaccinated against smallpox, and so today children don't have to get vaccinated against smallpox at all. Many believe that an infant does not have a strong enough immune system to fight off the antigens in recommended vaccines. Although it seems very logical that an infant is not ready to fight off the antigens in vaccines, they are. And it's all thanks to the child's mother. According to the CDC, mothers provide passive immune support to her infant while in the room that lasts through the child's first year of life. And according to the Australian Breastfeeding Foundation, mothers can provide additional support through breast milk. According to the National Center for Immunizations and Respiratory Diseases, it is much safer for infants to gain artificial active immunity through vaccines than active immunity through the actual disease. Now that you understand the idea of immunity behind vaccines, how do we know they're effective as we say they are? Throughout their history, vaccines have been proven to be effective. According to the study performed by the CDC comparing the amounts of death from a disease before the vaccine was introduced for the number of reported cases in past years since the vaccine has been produced shows that nearly all vaccines have shown a reduction in disease by at least 90%. This includes the report of measles being reduced over 99%, and smallpox had no reported cases, and diphtheria also had no reported cases. Vaccines are carefully balanced and planned by the CDC. The CDC has prepared 2 different on-time schedules, one for those who are healthy and one for those who are already immunocompromised. And this can be children with cancer or any other, sometimes chronic liver disease. This shows that scientists are not just trying to inject children at every possible moment, but rather scientists are considered to a child's each individual needs. The CDC can also make personalized makeup schedules for those who have been behind and now they're trying to catch up. Now that you understand that vaccines are effective and there is more than one way to receive vaccines based on your child's needs, it gives you a chance to think about the power of vaccines. Imagine a world where children didn't have to die from preventable diseases. According to Every Child by Two, a group that raises awareness about pediatric vaccinations, a 5-year-old boy named Landon Carter Duke was being monitored by his parents after switching formulas because he was having a lot of trouble spitting up, which is pretty common. So his parents noticed a change in his behavior after switching the formulas and took his temperature and realized it was 100.1. They rushed him to the hospital, and after many tests, he was admitted and diagnosed with pertussis. He was put on a breathing device to help him since he had so much mucus in his lungs. This wasn't doing enough. He was switched to an oscillator, which still was not supporting his young body enough. He later had an ECMO put in through his neck, which was the last step in which they could save him. He was unable to release any urine, and his organs doubled in size because of the stress that pertussis put on his body. His kidneys shut down, and they tried dialysis. His body was so weak from the pertussis, and his organs were so swollen that his body could not handle dialysis. He died a short time later from pertussis complications. Landon was too young to receive the Tdap vaccine by only 3 weeks. He caught the disease by a failing herd immunity situation. If other people would have been vaccinated against pertussis and protected him from the disease, Landon would have turned 8 years old next month. If we have our children vaccinated, we can stop children from dying from preventable diseases. And if not, there will be many more children like Landon. Every parent wants to be the superhero of their child's life. Be that superhero by saving their lives and the lives of other children by getting them vaccinated. With a simple 1, 2, 3 pinch, you can be the reason that no child dies from preventable disease. To set up an appointment for your child, contact your local pediatrician or pharmacy for more information of when and where to get your child vaccinated. If costs are a concern, low-income families may qualify to receive vaccines for little or no cost. And also, for low-income families, Medicaid is an option because all vaccines are covered by Medicaid. For more information on the Vaccines for Children program, visit the link on the screen.